Hey everyone, welcome. It's September 18th and we are doing a live Q&A on hemangiosarcoma in dogs. It's been quite a few months. We kind of took the summer months off from our Q&As, but I'm really excited to be here and to be back and to answer your guys' questions on a really tough cancer in dogs. So we are going to give everybody a few minutes to hop on. And hopefully we can get going and we'll jump in with some questions. I'm going to give you some updates on where you can find some information. I just hopped on Instagram as well. So welcome everybody on Instagram as well. I am doing a live Q&A on Facebook on hemangiosarcoma in dogs. So I just wanted to remind everybody who's on Instagram who may have forgotten that I am doing this live Q&A. So we're not going to stay on both because it becomes too difficult to me to multitask on all the different devices. So, hey, Belinda, thanks so much for hopping on. We're going to wait a few minutes while people hop on. I'm going to tell you about some of the updates because I've really kind of changed some of the information that I have and where I'm putting it out. And I just want you guys to know, hey, Angel, where you can find all of the information that I'm putting out. And a lot of it is on YouTube. So I really want to make that a good resource because it's really easy to be able to find information later on YouTube. So I like to do the Q's and A's here on Facebook, but this Q&A, if you miss it or want to watch part of it again, will be in the hemangiosarcoma playlist on YouTube. So let me kind of just back up in case this is your first event with me. Thank you so much, everyone, for joining. My name is Dr. Sue Ettinger. I am a boarded medical oncologist in the Metro New York area. I'm currently practicing in Connecticut, but in Lower New York, the states are really close together. So I'm at the Veterinary Referral and Emergency Center in Norwalk, Connecticut. If you're ever looking, where I am, you can always go onto my website, which is drsuecancervet.com. I do have that we can put that up on the screen just so you guys can find me. So that's always a good place. I have lots of pet owner resources there as well, such as skin maps, my chemotherapy information sheets, side effect sheets, and things like that. So that is always a good place to kind of find lots of my different resources. Again, just go to the pet owner resource section. And we've actually just recently updated my chemotherapy information sheet. So if you had one from last year, you'll want to go there, print out a new copy of the chemotherapy information sheet and the side effect sheet. So again, just recently updated, probably about 1 or 2 months ago. Hey, Ben, I should say Dr. Jasper. So Ben is a veterinarian now for probably about a year and a half who mentored with me as an undergrad student and as a vet student as well and went to my alma mater. So thanks for hopping on, Dr. Jasper. So happy to have you here. So guys, we are going to hop into it. But before we do, because I'm sure there are lots of questions, I just wanted to let you know what I've been doing on YouTube. So on YouTube, my previous vlogs were more about my day, and they're still good if you kind of want to see what it's like for, as I say, your pet behind the scenes when they go back, to get x-rays or blood draws or chemotherapy. But I've really decided to kind of shift my gears towards giving you informational videos. And I just published, I think a couple of weeks ago, a 3-part series on hemangiosarcoma. So those are vlogs number 84, 85, and 86. And so you're probably going to want to make a cup of tea when you watch them. So I'm having a cup of tea right now. They're kind of long and they have lots of information, but that's the whole point, is to give you guys information. So 84, the first one is about splenic masses. So not all dogs that have a mass in the spleen are hemangiosarcoma, and I break that all down for you. The second one, vlog number 85, and we'll throw these links up hopefully for YouTube in the comment section, is about the symptoms, what you may see with a dog with a hemangiosarcoma, and the different diagnostics that I recommend and the ones that you can skip. So there's definitely tests there. You don't have to do every test under the sun for a dog with hemangiosarcoma, so you can watch that. And then part 3, vlog number 86, are the different treatment options. And I'm sure there'll be some questions on that, but I talk about classic chemotherapy, I talk about about metronomic low-dose oral chemo and where the studies are with that. And then some new things that aren't available yet, EBAT, which is something that's in clinical studies. We'll talk about polysaccharopeptide mushrooms, so immunity. But again, all that information is there as well. So again, I'm sure there'll be questions about all that, but again, the information's there. So please go to YouTube, check those videos out. The last Q&A that we did is also there as well. And while you're there, I would be so appreciative if you guys did two things for me. Please subscribe if you haven't yet done. That really helps me in the YouTube world with the algorithms and things like that to get these videos seen, and comment. Please comment. And also, if you know somebody who would love these videos, that needs these videos, is going through this, share them. And again, we have all different ones there. Next month, October, is Breast Cancer Awareness Month, and I just last night or Monday night filmed videos on mammary tumors in dogs and cats. So those are coming out. New video comes out Wednesday. We just did part 2 of different lymphoma protocols for dogs. So, and guys, if you have topics that you want to do, you can let me know either here or in the comment section in YouTube as well. Okay. That's about it. So that's pretty much my intro that I have. So for everybody on Instagram, if you are interested in going, hearing questions on the Q&A, please come on over to Facebook, join us there. I would love to have you there. Definitely check out everything on YouTube, but it's too much for me to watch 2 screens. So thank you so much, guys. And hopefully we'll see you on Facebook. All right, guys, on Facebook, you have my undivided attention. I promise. That's what. Okay. So I'm ready to do your guys' questions. So let's see where we are. So thank you. Caitlin has put all the links in there for us. So hopefully, guys, thank you so much for joining, but I'm ready for your questions. So I'm going to scroll through. Angel from LA. I wish I was in LA right now. I was just talking to somebody who's out in California, was sending me pictures of the ocean. So that is great. Okay, so we have our first question from Melody. Let's see, I think I can show the questions. Okay, and then you guys can't see me, but that's okay. The questions are more important. So, Dr. Sue, in your video regarding hemangiosarcoma, you mentioned other malignant tumors that are not hemangio, but you did not mention histiocytic sarcoma. There are groups of many on Facebook with dogs in this diagnosis. Can you offer the difference between hemangiosarcoma and histiocytic sarcoma? So yeah, and actually when I'm going to just put that question away. Well, actually, I can leave it up because that way if anybody wants to look at the question. So basically, hey, Lynn, welcome from Canada. But it's a great question, Melody, and I'm sorry that I didn't mention it because when I lecture about splenic masses in dogs, histiocytic sarcoma is definitely included. So maybe it was just, glossed over or just not there. But let's kind of break it down and go through it. So they sound similar, but they're completely different tumors. Histiocytic sarcoma is a malignant cancer. The breed that we classically think that we know is predisposed to it is Bernese Mountain Dog. So there's a genetic predisposition for Bernese Mountain Dogs. We do see it in other dogs as well, Rotties, and you can see it in mixed breed dogs as well. But Bernese Mountain Dogs are definitely the ones that we typically see it. It's a multifocal cancer, so it's usually in multiple organs. The spleen is a very common one. So we can see it in the liver. It can also be in the central nervous system as well, sometimes in the bone marrow, and sometimes they'll actually have skin lesions as well, and lung lesions. It can be solitary, so they can just have one mass in the spleen, one lesion in the lungs, but it's usually going to be multifocal. So it's not in general going to be one where, different than hemangio, where you're going to do a splenectomy. So you're not going to remove the spleen in most cases, unless you can prove with your chest x-rays and your ultrasound that it's only in the spleen. But most of the time with histiocytic sarcoma, you're going to do chest x-rays and ultrasound or and find it in multiple organs. Sometimes you can diagnose it with aspirates. Sometimes you're going to need a biopsy, and sometimes when you submit it to the lab, you're going to have to add on those special stains because it can be a challenging one to diagnose. Because it can also be bone marrow involvement, it's not uncommon in these dogs to see different issues in the blood, things like anemia and other things like that. So it's actually, histiocytic sarcoma is on my list of vlogs to do. It's not a super common cancer, but it's not also uncommon. So we do see it not uncommonly. Because it's a multifocal cancer and you're not going to be able to cut it out, it is one that we treat with chemotherapy, and typically lomustine, an oral drug that we also use for things like mast cell tumors and lymphoma, is one of the first drugs that we go to. So hopefully, Melody, that answered your question. Sorry that I missed out on that, but it's a great question. And that is sort of the 3-minute version on histiocytic sarcoma. It's a tough cancer. The median survival time is about 6 months, so pretty similar to hemangio with surgery and chemotherapy, but I've definitely have had long-term survivors. So I do think it's worth treating, and some studies suggest that the dogs that just have a solitary lesion will do better. But again, chemotherapy is the mainstay of treatment, and then some dogs will have surgery and sometimes radiation as well. So case-by-case basis, definitely one to consult with an oncologist. And just as always, we will put the link for vetspecialist.com, which is where you can put in your zip code and help find a cancer specialist that is close to you. Okay, so Jan says, what is the latest information on immunotherapy treatment? So that is a really broad question and probably not really related to hemangiosarcoma. I mean, I'm willing to answer it, but immunotherapy has not really had a big role in hemangiosarcoma at this point. So immunotherapy sort of, if we just take a step back as the 30,000-foot view of like what it is. So when we give chemo, so like for hemangiosarcoma, since that is the topic that we're talking about, for hemangio, you know, we are giving, sorry, like just got a pop up. We are giving chemotherapy, which is going to kill rapidly dividing cancer cells, and that's the goal. So we're trying to kill cancer cells. When we're giving immunotherapy, sort of as a sort of general, what we're trying to do is you're trying to give something that's going to stimulate the immune system to attack the cancer cells. That often involves the immune system through different mechanisms, whether it's something called apoptosis or just different ways that the immune system works. So the way, there are certain cancers that work well with immunotherapy. So right now there's the canine osteosarcoma vaccine, which is a listeria vaccine combined with a target called HER2/neu, and that is in development right now in clinical trials. There is a vaccine for lymphoma, which has been on the market for a couple of years, and now there's some newer studies looking at its efficacy again, which looks a little bit more promising than some of the earlier studies. And the one that's really been on the market probably, I don't know, I would say for at least 10 years, is the immunotherapy for melanoma. So the melanoma vaccine. So that's an immunotherapy that uses a target called tyrosinase. So those are sort of the main ones right now. There's not a lot of immunotherapy that's known to be effective for hemangiosarcoma at this point. But it's always very interesting, you know, to try to use the immune system to attack the cancer cells. So, but that's sort of the update and the big cancers that I think about when I think about immunotherapy. So for dogs, I think about, again, osteosarcoma, lymphoma, and then melanoma. Again, you know, hopefully more stuff in the pipeline and coming down, but that's what we got so far. All right. So what other questions do we have? It's a quiet night, guys. Any other questions? Always gives me an opportunity to take a sip of my tea. So any other questions on hemangio? So some of the, let's see. So Jan is asking another question. So I heard of a procedure where a sample of the vaccine, a sample of the tumor is sent to a lab that produces a custom vaccine, so to speak, tailored to a specific tumor. I guess I was thinking of that. So yeah, so that is, there are some And that can be done for some other cancers as well. So it's, so yeah, they take a piece, you would take a biopsy, submit it for your dog to certain labs. So that can be done. I wouldn't say that we know that there's significant efficacy for that. It is very interesting, but it's not really the standard of care, and I can't really give you response rates or improved survival times or things like that. So I think that's just something that we're going to have to wait on to see more data. So, you know, we'd like to at least have proof of principle and then, you know, efficacy that it works before we start doing that. So it's a great question, but I don't really have enough data to go out and recommend it for my patients. So Dr. Jasper says, can you diagnose suspected cardiac hemangiosarcoma and pericardial effusion cytology? So that is a great question. So, and this is good. So, you know, one of the questions that I get, and so I think in part 2 of the 3-part series that I did on hemangio, I tried to touch on some of the non-splenic forms of hemangiosarcoma. So that's one of the complaints that I often get is, what about the other forms of hemangiosarcoma, or what about, you know, the lesser common tumors and things like that. So in part 2, I did try to cover some of the other locations. So let's kind of just give a little overview. So cardiac or heart hemangiosarcoma is the second most common location that we see hemangio. So hemangiosarcoma is a malignant cancer of blood vessels, and we definitely have blood vessels everywhere. So as superficial as our skin and as deep and, you know, as in our internal visceral organs, as we say. So the primary place that we see it, the most common place that we see it, is the spleen. And then the heart, which I always say is just a big blood vessel, right, is the number 2 location. And so often, you know, both locations, the spleen and the heart one, this is a cancer of blood vessels, and they often have these cavities of blood that they fill with blood, and then they often rupture. So dogs with splenic hemangio and cardiac hemangio will often have these episodes where they're bleeding into the cavity around the organ. So for splenic hemangio, they have a hemoabdomen where they're often bleeding into their belly. It's called, to their abdomen. If it's a slow bleed, these dogs, you know, it may not be something that you as a pet owner notice very quickly because they're not getting dramatically anemic. If it's a dramatic bleed, they're shocky, they have pale gums, your dog is very, very weak, and you're bringing them to the emergency clinic because they're dramatically sick. They're bleeding into the belly. A slow bleed, some of these dogs will transfuse themselves, auto-transfuse. When the heart one bleeds, when the heart-based ones, the right atrial ones bleed, they bleed into the heart sac. And that is like a big balloon. And the problem is when that heart sac is filling up, it really starts to compromise the ability of the heart to pump effectively and, you know, all of the electrical conductions that the heart needs to do. So these dogs have, you know, arrhythmias, and it can be very life-threatening. And so one of the questions is often, and I'm, you know, Ben, I'll put this for both the abdominal fluid and the heart fluid, the pericardial fluid, is studies have tried to look at that because these cases can be really hard to diagnose before you go to surgery. And, you know, for the abdominal ones, that if I'm kind of, you know, giving away part of part 2, you know, submitting that fluid to the lab is usually a waste of money for fluid analysis because usually they can't see the cancer cells. People have tried to look at the pH, other things like that, to see if there was something about that fluid that would let us know that it's cancerous and let us know that it's hemangio. And usually submitting that to the lab has not been shown to be beneficial. There's usually just not enough free-floating hemangiosarcoma cells there. Same thing for the heart fluid, usually not something, you know, every once in a while you're going to get lucky and they may see a cancer cell there. But in general, I do not recommend submitting that fluid. People have tried to look at other sort of like troponin levels and other things like that. But to my knowledge, there's nothing that we can run routinely on that fluid that can let us know whether or not it is hemangiosarcoma or not. So that is really, really frustrating. And that's the frustrating part with the splenic masses as well. And I go through this, you know, like over and over in the videos, is there are so many dogs that are told that their mass in their spleen is hemangio, and you can't tell based on appearance, size, so many different things, and you don't know until you get your biopsy back. And so I often, see too many dogs that are condemned and told that it's definitely hemangio before they go to surgery. So unfortunately, Dr. Jasper, no, there's nothing really fabulous about submitting that fluid. Sometimes you get lucky, and I don't mean lucky, but I mean that from that fluid. Obviously, we don't want to diagnose hemangiosarcoma in our patients, but that fluid submitting it is usually not helpful. So someone said, what do you think about the cancer vaccine? So I'm not sure what vaccine, Jen, that we're talking about. If we're talking about the immunotherapy that I just talked about. For the other cancers, to my knowledge, there's not a hemangiosarcoma vaccine, the one that we talked about where you take a piece of tissue and send off. I'm not aware of a lot of good data showing efficacy. Oh, I'm going to jump up and put up that comment from Kate Baker. So I'm going to guess it's Dr. Baker. She says, I'm a clinical pathologist and totally agree with Dr. Sue. Whew! I was happy when the clinical pathologist. Sometimes I wish I was a clinical pathologist, so I have envy Dr. Baker because I love cytology. I'm a little geek. I've read thousands of fluid cytologies, have never diagnosed hemangiosarcoma on fluid cytology. The cells don't exfoliate well in the fluid. So, yay! See, I'm not making this stuff up most of the time, guys. Thank you, Dr. Baker, for joining. It's really, really great. I love when there are other people that could help. I'm going to jump up real quick. Thank you really so much for joining. Yay. Jen, just follow up on the same question, asking about a new drug, but we're going to come back to that because I don't want to miss anything. That they're in order. Oh, Heather, you just asked a really good question. I'm going to come back to that. So what are your thoughts, Angel says, on surgical removal? Okay, so Angel, who I appreciate because she comes all the time. So what are your thoughts on surgical removal of small cutaneous hemangiosarcoma? Can't speak tonight. I knew this was going to be a problem. It's late here. What are my thoughts on surgical removal of small cutaneous hemangiosarcoma tumors? Recommend margins, chemotherapy, or radiation follow-up. Any thoughts on electroporation? Okay, so when we're talking, and this is good. So again, we're stepping away from the splenic one, which is good. I want to be able to address all of the other types of hemangio as well. So my skin maps, which are over on my desk over there. So guys, lumps and bumps, this gives me the opportunity to remind everybody that, my program, see something, do something, why wait, aspirate. I can't look at a mass, you can't look at a mass, and none of us can know what it is. So we have to do those aspirates. And so when we're talking, about hemangiosarcoma, it's really important, but I'm just going to remind everybody, we have calipers, we have caliper pens. We want to measure these because, ideally we want to get these tumors off when they're small. So the size of a pea, which is 1 centimeter. So, all of these have things that we can measure on. So we really want to get all our lumps and bumps, whether they're mast cell tumors or hemangiosarcoma, off when they're small. So again, that's just my little plug to make sure that monthly, guys, you are doing a lump and bump exam. So vlog number 73 is one of my favorite because it's all about doing lumps and bumps. So we just put a link for the skin maps. Those are on my website. But, I usually recommend, when you're giving your dog the top of the month, the first of the month, when you're giving heartworm preventative, flea and tick preventative, when you're dogs and cats, you should be doing a lump and bump exam from nose to tail. And you should be noting and marking down any of those lumps and bumps. And again, if the mass is the size of a pea and been there a month, we want you to go to your vet for an aspirate. So to go back to Angel's question, there are superficial hemangiosarcoma, and those are actually good hemangiosarcoma. So not an oxymoron. I actually just said good hemangiosarcoma. And so all hemangiosarcoma are not created equal. The splenic ones, the internal organ ones, are very aggressive with a very high metastatic rate. The superficial one, the cutaneous ones, can essentially be cured with surgery. So my thoughts are, if you have a small cutaneous hemangiosarcoma, you want to do surgery, you want your veterinarian to look at the biopsy report and make sure you got margins, but we don't typically do chemotherapy. The difference is, or the distinction is, we need to look at the biopsy report and make sure it's not subcutaneous, because there is a very distinct difference in how those behave. The subcutaneous hemangiosarcoma do have an increased likelihood of metastasis or spread. They still can have a good prognosis. Some studies say about 1.5 to 2 years, but I do recommend chemotherapy for those. So often for those ones that are in the skin, I'm really reading those biopsies very closely, and often I'm getting a biopsy second opinion from a really good veterinary cancer pathologist to make sure that they've looked at how in-depth that biopsy is. So if it's over a location like the distal leg where it's hard to get margin, so over the wrist, the carpus, over the ankle, the hock, where you can't get margins, you know, maybe it was a big tumor and it wasn't found small, radiation could be a great way to prevent the tumor from coming back. But if it's truly a skin superficial cutaneous one, I don't typically use chemotherapy for those. Again, the subcutaneous ones are a little bit different. And the electroporation, I think you're talking about the electrochemotherapy. I don't personally do that, but I do have a good number of colleagues that are doing that. I'm not sure if hemangio is one of the ones that they're using it for, but for some of these non-surgical tumors, they are seeing some good results. So I would have to check in with one of them and refer, you know, to one of those. But there's probably about 40 or so oncologists of the 400 of us that are doing electrochemotherapy. So that would be an option. But if you can cut that thing out, submit it for biopsy. That's always going to be the option. And that's always the advantage of early detection and feeling your dogs and cats, you know, for if finding them early, because you can find things when they're small, you should be able to get them off no matter where they are in the body. So that's the whole point of the size of the P, which is a centimeter. All right. So great question, Angel. Thank you for joining. Jana is just wanted me to mention that there's a new drug in development, the immunocytin trial for hemangiosarcoma, which is being done at a couple of institutions, including, I think, Iowa. So that's something that hopefully we'll have more information about, but not yet clinically available. If there is, I don't know the website where they can go, probably Iowa site or things like that, but Jenna, you're welcome. If you have a website that you want people to be able to get more information about that, you can throw it in a comment and that would be great. Okay. Oh, you're welcome, Angel. Thank you for coming all the time. I appreciate the love and support. Want to take a sip of tea? Oh, guys, these are my new mugs. I'm not selling them. I'm just using them as giveaways at veterinary conferences. And we're going to be doing a giveaway on Instagram only on Friday. So if you want a mug, hop onto Instagram on Friday. And for those of you that know me, I don't usually use open containers near my laptop because I'm a klutz. So hey, Mark, welcome. So let's just make sure this goes well. Okay, so we're trucking along. Stacy, welcome. Thank you for your question. I have a female who is 4 and she has a few masses develop and we've had them aspirated and nothing has shown so far. Do you suggest continuing to check each one that develops? She has another. They all appear in her spine area. So I'm going to try to answer that the best that I can. So kudos to you, one, for aspirating them. Keep track of them on the skin map. So if your vet's not using the skin map, you can print them out and say, hey, can you put them on a skin map? So I try to put them on the skin map and make a copy of it, and we scan that into the medical record at our practice and then usually send the client home with that, especially if there's a lot that we're keeping track of. So if they're aspirated and they're nothing, so like they're benign lipomas, that's great. There are some tumors like sarcomas, like soft tissue sarcomas that don't exfoliate well. And so for those, there are some cases where you're going to need to biopsy them. So if the mass is continuing to grow, it may be one where you need to say the aspirate's not working for us and we need to go and do a biopsy and get a piece of it before you remove it. So I do have other Q&As on skin aspirates as well. So those are the, would be other ones. And I do have a whole playlist on why weight aspirate and things like that. So every mass is an individual. And so, and the whole reason that I developed the See Something, Do Something, Why Wait, Aspirate program was from my technician's dog, Smokey, who had about 10 lipomas over the years. And the next mass that he had that we got complacent was a soft tissue sarcoma. And so, you know, you don't want to say, well, everything else has been benign so far, so I'm sure the next one is another benign lipoma. So you just need to keep on top of it and be vigilant. And then I've had dogs that have had mast cell tumors, and I think that the next mass is going to be a mast cell tumor, and it's a soft tissue sarcoma, and then we have a lipoma, and then we have a benign keratin cyst. So you just have to keep aspirating them, and if the aspirates are non-diagnostic, or the aspirate looked like it was benign, but it keeps growing and it's acting more aggressively, then we need to biopsy it and see what it is and do something a little bit more, you know, talk to your veterinarian. But that's the in general recommendation. But don't get complacent. But Stacey, also good job for staying on top of them. So that's really, really important. But definitely check out vlog number 73 about the lumps and bumps and just how to stay on top of it, how to do the exam. I talk about measuring them, how to use the skin maps and the calipers and things like that. And then you can watch some of the other videos, the Q&As, where I talk more about that as well. But I think vlog number 73 is always a good place to start. And we do a lump and bump exam. I think Matilda on that. So you guys will notice if you watch any of my videos, usually Matilda and Penelope, my Labradorks, as I call them, are my models. And we pay them in treats, so, or carrots, so they're pretty cheap. So it's pretty good. Angel wants to know any new chemotherapy drug combinations showing promise, anything from the human world. So yeah, so this is a really great question. So, you know, for hemangio for a while, there just really hadn't been any new news. And so last year, so in 2018, there was actually a good number of talks at my conferences at ACVIM, which I was really excited about, and this year as well. So some of this is still in trials, and that's frustrating but exciting at the same time. So, you know, doxorubicin is the main drug that we use. Often we'll use low-dose oral cyclophosphamide as well. There's some studies, you're welcome, Stacy. There's some studies, preliminary studies from Colorado that Dr. Tham talked about, that maybe carboplatin has some efficacy as well. There are some studies at Minnesota looking at this engineered toxin called EBAT that are still in clinical trials. So that looks promising as well. And the cool thing about EBAT is that it looks like that also may be able to be used as a chemopreventative in high-risk dogs that they test for and that have some of these abnormal cells or these mutations. And so they have a program called Shine On, and I think they're in the 3rd phase of their study. So some of the new things that we have going on are EBAT, this engineered toxin that's being studied at the University of Minnesota. Carboplatin, a drug that we've been using for, you know, is most commonly used for like osteosarcoma and some other carcinomas. So that's a drug, you know, that we have lots of experience with that could have efficacy. I use, in some cases, ifosfamide in dogs that are, you know, resistant to doxorubicin. That's another option as well. And there's some studies showing for that as well. There's also some studies looking at that we're waiting for the Animal Medical Center, where I did my residency, looking at propranolol. So some of these beta blockers and blood pressure medications, and whether or not they'll have efficacy as well. So there's definitely some studies going on, which is exciting. We don't have all the results yet, but I'm just excited about that. The other studies that have been going on are looking at metronomic low-dose oral chemo. And I have to say those results, when I summarize them for my study, kind of a mixed bag. Some of them said they're effective. Some of them say that they're not. So that jury's still out. So, you know, Angel, to answer your question, I don't think we have all the answers yet, but the good news is there's studies being done. So I think that is, you know, really, really important. Deanna says, hey, I'm late. Deanna, that is okay. I appreciate you being here. All right, so we have some questions about vaccines. I just want to scan through, make sure. There's a few questions I definitely want to make sure. So one of the questions that came up was about recent information about tick-borne diseases and hemangiosarcoma. And so this is interesting. I actually just went to a talk about this June at my conference. And again, small studies, but there's some really interesting work being done at the vet school at NC State, looking at Bartonella and an association with hemangiosarcoma. There's some studies looking at dogs that have had Bartonella in association with lymphoma. So they don't have everything figured out. And I don't know all the details, but we do see a lot of tick-borne diseases, and some of my patients, I've dealt with Bartonella. So I have a sort of personal, professional interest in that. So that is how I ended up in this small lecture in the research track about it. So Heather, I don't have that much more information except for that there is a link. They did look at some of the other tick-borne diseases, and from what I remember, it looked like it was Bartonella. Don't quote me. Definitely not my complete area of expertise, but there is a link there. Why it causes the transformation and what the cause effect is, I don't think they completely understand, but it's a great question. And again, I'm giving you a lot of answers that are saying we're in the process of learning more. It's exciting and frustrating at the same time. Let's see. So one of the questions here says, do I recommend Bio for my hemangiosarcoma patients? And this is a great question. So I have two places that I want to refer you guys to for more information on supplements, but one of them is vlog number 39, where I just talk about the probably 6 or 7 supplements that I use in my cancer patients as a whole. Bio I don't recommend in all of my patients, but just the general supplements that I like and recommend as a medical oncologist. And then I do talk about specifically supplements for hemangiosarcoma in the third part of the hemangiosarcoma series, which is vlog number 86. So Bio is an interesting Chinese herbal supplement that the active component is notoginseng. There's a bunch of other stuff in there. When I read some of the ingredients when I lecture, I always my mind always looks at ox bile. So I don't know why there's the bile from ox in there, but there is. But notoginseng is this active component, and it's this Chinese herbal supplement that can stop bleeding. One of the other cancers that I will often use is for dogs with nose tumors that have nosebleeds. Internists will use it as well for dogs that have nosebleeds. So that is a good use for it, so bleeding. So I will use it for dogs that are having bleeding issues. So if we have a dog with a splenic mass that the owners decide not to go to surgery, it's intermittently bleeding, we can use Bio. If I have a dog that has had their spleen removed, we've been treating with chemo, and at some point it spreads to the liver, and now those masses are intermittently bleeding, I will use Bio. I do not use Bio as part of their chemotherapy protocol. There's some question as to whether or not it has an anti-cancer property, but hasn't been shown yet. So I don't use it as part of their protocol, but I will use it if they're having bleeding issues. When you buy it, I actually have an old pack somewhere around the house that is expired, but it comes as a pack of capsules. I think there's 15, and then there's a red hit pill, and the red hit pill you're supposed to take for in a crisis. So if I have an owner that tell me the dog is dramatically bleeding, or a dog with a splenic, the dogs collapse and they're having a bleeding event, we will tell them to take the red hit pill. I mean, this is something that if you look at the history behind it, the North Vietnamese soldiers used to have this in their army pack, and one of the old instructions for the soldiers was to take it with red wine. So we don't have the dogs take it with red wine, but sometimes I tell the owner, if your dog's having a bleed, you can give that to your dog and then have a glass of wine while you're waiting for it to have its action. It works. It definitely works. It comes from China. Years ago, Deanna just said she gave it to her dog Blue, which had a nose tumor. I used to have to tell my clients to go down to, I'm in the metro New York area, north of New York City. They used to have to go down to Chinatown. Now you can usually get it on Amazon. Sometimes it's on back order. Many veterinary hospitals will, keep a couple of boxes in stock because it's that useful. It's, it's not an FDA approved drug, it's a supplement. So that's where I use it. I will use it for periods of bleeding or for dogs, like I said, that have metastatic lesions to the liver and they're intermittently bleeding. That's where I think that there is a good place for Union Bio in the patients. Again, if someone can do more studies and says that, yeah, it has, an anti-hemangiosarcoma property, then I would consider adding it to their protocol. There are some concerns with like liver issues. It's not, it's not regulated. It doesn't, it comes from China. So it's not there's little, regulations with the processing of the supplement. So that's always, the safety and purity has been an issue as well, but we have some issues with vitamins from the US and Canada as well. So to me is not a reason not to use it, just something to think about. So Kristen, good morning from Australia. So it is September 19th and down under, right? So that's always exciting. Let's see. Okay, so let's see what other questions we have going on here. So now I scrolled up and down. So Sherry had a question, is there a definitive genetic component for intramuscular hemangiosarcoma? So it's a great question, and I'm gonna broaden that, say, is there a definitive genetic component to any of the hemangiosarcomas? Hey, Andrea, Dr. Honigman, thank you so much for hopping on. We have a couple of veterinarians joining me today, which is great. We don't know a definitive genetic component to hemangiosarcoma at all. And I'll be honest, for a lot of these cancers, there isn't, and there usually isn't just one genetic mutation or role in it. It's usually multifactorial, which is, I kind of roll my eyes because it's just one of those words that oncologists like. So, I think for all of them, when we see certain breeds predisposed to it, we usually get concerned that there's a genetic predisposition. For splenic hemangiosarcoma for years, it's often said that this is a cancer of large breed dogs. And I have to say, Dr. Modiano, Jamie Modiano at Minnesota, where they're doing those Shine On studies with EBAT, him and Dr. Borgatti are, definitely the gurus for this. But he was one of the ones that I went to the lectures in 2018, and he really said, we need to stop being breed biased and large dog biased for splenic hemangiosarcoma. This is a cancer of dogs of all sizes, and we're probably breed biased with that. So again, I think that's a really important thing. In the series, I also talk about if your dog has an incidental splenic mass, so they're getting an ultrasound of their spleen or of their abdomen for something else, like their liver values are elevated or their kidney values are elevated, and they happen to find a mass in the spleen, there is, it is much less likely to be a malignant hemangiosarcoma than the other scenarios where the dog presents, and they find is sick and they find a mass in the spleen. So, I really talk about that a lot in the first one, because again, there's often this presumption that if your dog has a mass in the spleen, it's always hemangio. If there's bleeding in the abdomen, it's more likely malignant hemangio. If it's an incidental tumor, it's less likely. But I really break that down in a lot of detail in vlog 84, the first one. So I really want to go through that because it does frustrate me when people say, oh, the mass in the spleen, it's definitely hemangiosarcoma, we should just euthanize the dog. And so I think that's a disservice to the dogs and the owner. So I feel really passionately about that. So I would like to dispel that myth. So, okay. Let's see. Let's do another, sorry, trying to read another questions. So Mark, looks like you have a question possibly about an insulinoma with insulin glucose ratio. I'm going to skip that for now because it's kind of a long question and a little bit off the beaten track right now, just because we're focusing on hemangio. I'm going to try to come back to it, but that's just a little bit, like I said, I'm trying to keep this focused on hemangio for now. Maui. So Tev is here from Maui. So Maloha for going live. So Maui is one of my favorite places. So I call that my happy place. I was fortunate enough to lecture there, I think in 2015, took my family there, and that is one of my happy places. So I would love, love, love to come back to Maui. So beautiful, beautiful place. So Melody, just to go back to follow up with the Unum Bio question, if you have a dog with splenectomy, then nodules in the liver, no longer on chemo, intermittent bleeding, I would recommend Unum Bio every day, probably indefinitely. Again, just remember, guys, I cannot make, and this is a good time, Melody, for me just to remind you that that is a general recommendation, a hypothetical. I cannot make specific recommendations for you and your dog over the internet. It's just, it's inappropriate, it's illegal, and things like that. So I would consider Unum Bio to be a good option in that one, but I would definitely want you to talk to your veterinarian and just make sure that there's nothing else going on with your dog that would make Unum Bio not a good one, right? So, these videos, these live Q&As are never to replace having conversations with your veterinarian, but I think Unum Bio would be a good option in that case if there's intermittent bleeding and blood work is okay and things like that. And I did get it right that it is Thursday in Australia. So that is another place that I haven't been there, but there's on my bucket list. And I'm hoping to get there in 2020. That is my wish list. Okay. So sorry, just making sure that we're doing good on time. So Jamie made a good point about Unum Bio, that there was a study in Florida that published a study in 2014 about the benefit of killing hemangiosarcoma cells. If we're thinking about the same study, I was excited about that, but I think it was in the Petri dish, right? So that's called In Vitro versus In Vivo, which is very different, right? So you can kill cells in a Petri dish. It's going to be different whether or not that will work in the dog body or the human body and things like that. Yes, Kristen, I'm hoping that I get down under. I would love to go to Australia. So whether or not that's effective. So there are oncologists who use Unum Bio for dogs throughout their protocol. I do not. So I don't think there's definitive evidence to do that. And I think there's pluses and minuses in each case. So I, in general, don't. So again, if it's a study that we're thinking about, they were in the Petri dish, so in vitro, not in the dog. And even sometimes when there are studies, guys, it may be 14 dogs or not, they weren't all treated the same and things like that. So we have to evaluate these studies critically and look at them before we just say, yeah, that's the right thing. Joanne asks a very good question. So my question is, we know that VEGF, so vascular endothelial growth factor, is elevated in dogs with hemangio, and if so, by how much? I do not know offhand. Are VEGF inhibitors used? If so, their efficacy and increased survival time. So we don't have VEGF inhibitors that are available to us, and so I can't answer that question. So it is something that makes a lot of sense, sort of medically and rationally, but not something that we have that we can use. So I don't have those answers, but it's great questions. So Trina has a great question, and so we shouldn't forget little kitty cats. So any input on feline hemangiosarcoma? So it's much less common than in dogs. So usually we will see it of the skin and the subcutaneous. It's something we're going to want to find early. So lumps and bumps exam, guys. Surgery, the last couple ones that I've seen have been in challenging locations over the hock and the distal or the end of the limbs and things like that. So sometimes getting them off with surgical margins are challenging. I typically do recommend chemotherapy, but they often will have a better prognosis. I'm trying to think of the last time I saw an internal hemangiosarcoma, so like a splenic or a liver hemangiosarcoma in the cat, and I'm sure they occur, but I haven't seen one in years. So again, usually the hemangiosarcoma that we see in cats are going to be the superficial, so the cutaneous or the subcutaneous. The ones that I've been seeing more recently have been subcutaneous. I did recently see a weird one that was actually in the bone. So that's a good point. So remember, guys, blood vessels are everywhere in our body. So you can actually have a bone hemangiosarcoma. That is one of the possibilities when a dog or cat has a bone cancer, is that it can be hemangiosarcoma. So anywhere that you have a set like cells that transform and become malignant, it can become hemangiosarcoma. So Mark just asked a good question. So sometimes, guys, when I pause, it's because I see the question pop up on the screen and I'm talking about something else, and then I'm like, oh, my mind starts to answer that question. So Mark said he thought that tocitinib, which is Palladia, was a VEGF inhibitor. So it does inhibit VEGF. So it does inhibit some of the vascular endothelial growth factors, these things that promote blood vessel formation. The reason that it was developed, it's a c-KIT inhibitor, but it also, it's not selective, so it can inhibit some of the other ones. And so that is why it works in dogs when we use it for dogs with mast cell tumors, even if they don't have the c-KIT mutation, it can work. And that's one of the reasons it inhibits platelet-derived growth factor and vascular endothelial growth factor. And that's why we can also use Palladia in some of the other cancers. So hemangio and osteo, hemangio is not really the one that's been shown as well, but metastatic osteo and anal sac cancer and thyroid cancers are sort of the predominant ones. I do consider, and I do have a dog right now that is on, I will use it for dogs with hemangiosarcoma, but in terms of, her question, when I don't think of it really as a vascular endothelial factor inhibitor, the way is like something that is selective for that. So that's why I don't think of it as that, but it does inhibit that. But again, it's really a c-KIT inhibitor that happens to also inhibit VEGF. So a little bit roundabout answer to that question, but very good catch, Mark. But yeah, so you can use it for hemangio. There was one study that a couple of years ago that showed that using Palladia in dogs with hemangio was similar results to using doxorubicin, but then additional studies showed that it wasn't. So kind of the jury's still out on that. Okay, so we are getting close to 10 o'clock, so I'm going to wrap it up in a few minutes. I'm just going to try to scan through. So a couple of things. So the reason I have to wrap on 10 is I always promise my boys that I will be there to give them kisses goodnight. So that is my cutoff time, guys. A couple of things I just want to remind you. So this month on Facebook, we have graphics so that we put together. I've recently updated them, and they come out about 4 days a week with just sort of like highlights about hemangiosarcoma, and then I have more details, underneath the the graphic or above the graphic. I forget where Facebook puts them. So, definitely keep a lookout on Facebook for those so you can keep track, or get more information. But like I said, sort of chock full of brand new information are the 3 vlogs that I've done that you can find on YouTube as well. I know that, guys, someone just said diet and things like that. That is also on my list of YouTube. I can't get to everything. I'm so sorry. I've tried to kind of get to things. I mean, I don't think a specific diet is going to, it's a long question or a long answer. So I don't have a diet that I recommend. I will, subscribe to my YouTube channel. It's a video that I want to do is talk about diet and the different things that we can do, healthy diet, whether you want to home cook or, commercial diet and things like that. So those, the best I'm going to say is just subscribe to YouTube, be on the lookout for that. I drop a new video every Wednesday. This is what I need, guys. I want you to tell me what are the videos that you want, and then I will do my best to get them out as quickly as I can. So I really appreciate that you guys took your time out of your lives to come and join me. I hope you found it useful. If you did, and there's someone that you know that would like this, please tag them. Please share. Again, the things that I would love for you to do is subscribe to me on YouTube. Check out the hemangiosarcoma videos. Like I said, I put a lot of time into making sure that they're updated and full of information, and hopefully they're basically about, my lecture, about hemangiosarcoma. So those are the things that I'm doing. Remember, I'll be giving away a cup on Instagram, and let me just make sure anything else that I'm supposed to remind you. We got the Facebook, we got the graphics, reminded you about YouTube, skin maps, updated chemotherapy sheets on my website. That is about it, guys. I really appreciate you guys taking the time. If an ultrasound survival kit video. Heather, what do you mean by that, an ultrasound survival kit video? I don't know what that means. But I'm curious about that. Don't forget, guys, if you want to be able to keep track, we have calipers on my website. Oh, if you are interested, you can use Dr. Sue 2019. That will get you 15% off all the calipers. For the veterinarians out there, I do have digital calipers as well on the website. Like I said, skin maps and stuff like that. I have my cute little aspiration kit that Dr. DeWild has made me that I keep everything in, which every once in a while we do a giveaway for that as well. But those are super special because we don't have a lot of those. But again, thank you guys so much for joining me. Anything else? All right, guys. Thanks for joining. Have a super fantastic night. Enjoy the rest of your week. One on leukemia, please. All right. So I'm writing these down. Leukemia, diet. Anything else? Okay. All right, guys. Good place to remind me is comment on YouTube as well. Send me, comments there about future YouTube videos, topics that you would like. Thank you so much for joining. I really appreciate your time. Have a great night. And we just put a link if you're interested in the calipers. Thanks, guys. Thank you so much for joining. I hope you had fun. I hope it was informative. I hope it was helpful. And hopefully we can all kick some cancer's butt. Good night, guys.